My name is PereMillat and I'm going to explain the findings of the study Electrocardiographic Safety Evaluation of Repeated Courses of the hydroartemisinin in piperacin for use in mass drug administration. Mass drug administration campaigns have been considered for malaria elimination and used in some settings. The drug DHA-PQP is suitable for mass drug administration due to its long-acting effect. However, it's been questioned due to the possibility of cardiotoxicity. We conducted an interventional study in Ligir Island in 2015. Healthy volunteers aged between 3 and 60 years were included after meeting inclusion and exclusion criteria and admitted for 72 hours. DHA-PQP was given at the usual treatment dose following Papua New Guinea guidelines for 3 days during 3 consecutive months. 12 lead electrocardiograms were conducted at baseline prior to the third dose, 4 hours after the third dose, and at day 7 of each treatment course. Our primary endpoint was the increase of QT corrected by Friederichia formula between 0 hours and 52 hours of each treatment course. The results of this study showed that the mean and standard deviation of QT and increase of QT did not differ between the first and the third treatment course, as you can see in the first table. The graphic shows the differences in increase of QT along the trial. Interestingly, we can see that the QT returned to baseline parameters before the second and third dose of treatment. The last table showed the adverse events of special interest during the trial. There were 3 cases of QT increase of more than 60 milliseconds from baseline after the first course, and 1 after the second course and 2 after the third course. There were 6 cases of QT value between 450 and 500 milliseconds after the first course and 5 cases after the second and third course. There were no differences between the adverse events of special interest described during the trial. We did not register any case of QT of more than 500 milliseconds, and we did not register any severe adverse event for the 3 months of trial. As conclusions, we can say that QT prolongation did not increase in cumulative manner with repeated courses. QT interval returned to normal prior to its subsequent course of treatment, and that the absence of cumulative cardiotoxicity with repeated dosing supports the use of monthly DHA-PQP as part of malaria elimination strategies.